Hello everybody, now we are going to discuss cardiac cycle. So all of you know that cardiac cycle, it is nothing but cyclical events which are occurring at the level of ventricles. So I am writing here that cardiac cycle, it is nothing but events at the level of ventricle. Events at the level of ventricles. So when we are discussing cardiac cycle, we are least interested at the level of atrium. Obviously the atrium will go for contraction and relaxation, but we are mainly looking at the level of ventricle. So it is the ventricular events, right? Now we all know that both the atrium forms a separate syncytial tissue and both the ventricle also forms a separate syncytial tissue. So whatever is happening in the right ventricle, the same thing is going to happen on the left ventricle, right? Means both the ventricle is going to cause contraction simultaneously. But there is a little difference which you have to remember for your MCQ purpose. That is the contraction of left ventricle start earlier than right ventricle, very little earlier, although I am saying that both of them are syncytial tissue, but because the depolarization is occurring first in the left ventricle, the contraction of the left ventricle will also start a little bit earlier than that of the right ventricle. But if you look at the ejection of blood from ventricle, then right ventricle will start ejection a little earlier than that of the left ventricle, because you know the right ventricle is ejecting blood at the level of pulmonary artery where pressure is little lower than that of the arch of aorta. Obviously it is lower, and that's why the right ventricle starts its ejection earlier than that of the left ventricle, although contraction of left ventricle is starting earlier than right ventricle. So there is a very little time gap which we have to remember for our MCQ purpose, right? Now the next question is that what is the duration of the cardiac cycle? So all of us know that the total duration of the cardiac cycle is 0.8 second. So this duration is nothing but it is the 60 second, okay, that is 1 minute upon the heart rate in 1 minute. So if you divide this two, okay, you are going to get on an average 0.8 second is the total duration of cardiac cycle. We also know that this total duration of 0.8 second is divided into systolic duration, systole, and diastolic duration, where systole is 0.3 second, all of you know, and diastole is 0.5 second. But this duration of systole and diastole which I have written here, that is for the ventricular. So this is for the ventricular systole and diastole. But if we look at the atrium systole and atrium diastole, it is little different. Atrium systole is for very shorter duration, that is 0.1 second, and the diastole of the atrium is long, that is 0.7 second. So this duration is for the atrium, right? So all of you know this. You have to remember for your MCQ purpose atrium and ventricular systole and diastole. Now there is a question that if a person is doing exercise, what will happen to the cardiac cycle duration? Very simple question. So question is, if a person is doing exercise, so obviously the heart rate of the person will be increased immediately, and I told you this increase in heart rate can occur even before the starting of exercise, right? So whenever the heart rate is increasing, I can easily understand that the heart rate is in the denominator when we are calculating the duration of the cardiac cycle. So what will happen? Increased heart rate means there will be obviously total duration of the cardiac cycle will be decreased. Duration of cardiac cycle will be decreased. But more important question is that when the total duration is decreasing, which duration will be decreased, systole or diastole or both? This was the MCQ which has been asked multiple times. So remember, when the total duration of the cardiac cycle is decreased, your question is systole will decrease or diastole will decrease or both will decrease. Your answer will be both the duration will be decreased, but the diastolic decrement will be much more than that of the systolic decrease. Getting my point? So whenever your total duration of the cardiac cycle is getting shorter, right, diastole will be decreased much more than that of the systolic decrease, right? Because you know that the diastole is a passive process, so the decrement of diastole will be easier than that of the active process, which is the systole, right? So this way you have to remember that whenever heart rate is increasing, diastole decreases much more than systolic decrease. So this is the intro part of the cardiac cycle. Now we have to understand the different phases of cardiac cycle. So cardiac cycle means there will be some phases at the level of during the time of diastole, and there will be some phases during systole. And phases of what? Atrium or ventricle? We are looking at the ventricle. I am telling you repeatedly. So during diastole, what are the phases that we have to discuss at the level of ventricle? Look at the name of the phases: protodiastole, isovolemic relaxation, first rapid filling phase, diastasis, and last rapid filling phase. So isovolemic relaxation, I will write down like this, IVR in short form: first rapid filling phase, first rapid filling phase, and last rapid filling phase. I will write down like this during discussion. Similarly, if you look at the systolic phases, then this is isovolemic contraction phases, right? Then rapid ejection and slow ejection, right? So isovolemic contraction, rapid ejection, and slow ejection or reduced ejection. So these are the different phases in cardiac cycle. Now we have to understand what is happening during every phase of this cardiac cycle, because first of all we have to understand the different phases, and then only we will be able to understand the different applied aspect which are related to the cardiac cycle, right? So to understand the cardiac cycle, okay, first I am drawing one circle. Okay, so what I am going to do at this circle, we are going to plot every phases of cardiac cycle within this circle, right? Look at what I am doing. Okay, so I am dividing this circle into two halves. Okay, total duration of this circle is 0.8 seconds. So this is nothing but a cardiac cycle. Every phases of cardiac cycle will be plotted here, right? So the total duration of this cycle is 0.8 second. Now within this 0.8 second, I can easily understand that this small part, this is the portion of systole, and this bigger part, this is the portion of diastole, because we know the diastolic duration is 0.5 second and systolic is 0.3 second, right? So now we are going to start our discussion from the onset of diastole. You can start from anywhere, but if you start from diastole, it will be easier to understand. So we are going to start our discussion from this point. This is the onset of diastole. Okay, so this is the starting point of diastole of the heart. Now during this discussion, right, we are going to think of the right ventricle only for our easiness. Although we know that whatever is happening at the level of right ventricle, the same thing will happen at the level of left ventricle. But we will be looking at the right ventricle, but we know similar event will happen in the left, right? So first I am trying to think that what is happening at the end, at the beginning of this diastole, or I can say beginning of the diastole means this is nothing but end of systole, right? So first of all, I am trying to think that what is happening at the level of right ventricle at the end of systole. So this is right atrium and this is right ventricle. Look at this is the septum. Okay, so what I am drawing here, as if the right ventricle is fully contracted, tricuspid valve is closed, right, and the semilunar valve is open at the level of pulmonary artery, right. Due to full contraction of this right ventricle, most of the blood has been ejected at the level of this pulmonary artery. So this is my pulmonary artery, and very little amount of blood is still remaining inside the right ventricle. I hope you are understanding. So this is sketchy diagram, this is schematic diagram. Just try to understand that this is right atrium and right ventricular chamber. We are trying to think that what is happening at the end of this systole or beginning of diastole. So the right atrium is fully contracted, most of the blood has been ejected at the level of pulmonary artery, very little amount of blood at the level of ventricular chamber. Now from here, whenever the right ventricle will start its relaxation, just try to think, the right ventricle is fully contracted, now it is trying to relax. So whenever it is trying to relax, there will be expansion of the chamber volume. So whenever there is expansion of the chamber volume, if I ask you that the right ventricle is trying to dilate like this, what will happen to the pressure within this ventricular chamber? You will easily answer that the pressure will drop down immediately. So whatever I am saying, look at that right ventricle is fully contracted, now it is trying to relax. Whenever it is trying to relax, the ventricular pressure will drop down. And this dropping of pressure means what will happen? The blood at the level of pulmonary artery, they will try to fall back or come back towards the right ventricle because the semilunar valve is still open. But this coming back of blood at the level of ventricular chamber is not possible because we know that it will be immediately guarded by closure of this semilunar valve. So look at what I am saying. Okay, this is very, very important. If you just understand the beginning part, every part will be very, very easy. So what I am saying, that after the full contraction, whenever the right ventricle is just trying to relax, immediately the ventricular chamber pressure is dropping down. This decrease in chamber pressure means the blood at the level of pulmonary artery, they are trying to fall back towards the ventricular cavity, and that will leads to immediate closure of the semilunar valves. Everything, whatever I am discussing here, this closure of the semilunar valve, this part is happening within fractions of second. That means whenever the ventricle will start relaxation, immediate or the first event that is going to happen is the closure of the semilunar valve. So I am writing here that the onset of diastole or the start of diastole means it will start with the event that is nothing but closure of semilunar valves, right? So this is closure of the semilunar valve. Now you look at, whenever your semilunar valve is closed, now the ventricle will go for more and more relaxation like this, okay, more and more relaxation like this. So this relaxation is continuing with a closed semilunar valve, and the tricuspid valve was already closed from the systolic part, right? So the tricuspid valve is closed, semilunar valve is closed, means all the valves in the hearts are closed, but still the ventricle is going for more and more relaxation. So do you think the volume of blood which was already present in the ventricular chamber, that was very little, is that volume is going to change during this phase? Answer is no. The volume will remain same because all the valves in the ventricle are closed. So the volume of the blood is remaining same volume with the ventricle in a relaxation phase. This is known as the isovolumic relaxation phase, right? So just after closure of the semilunar valve, now I can understand that the next phase of cardiac cycle that is going to start. So here the next phase of cardiac cycle that is going to start is nothing but isovolumic relaxation phase. So this is the phase which is known as the isovolumic relaxation. I am writing here IVR, isovolumic relaxation phase. The duration of the phase is 0.06 second. So the isovolumic relaxation phase will persist for 0.06 second. Just hold on, I will give a color. This is very, very important phase. MCQ are there from these phases, so you have to understand. So during isovolumic relaxation phase, I can understand that the ventricle is relaxing more and more, but blood volume is remaining same. But what is the net result? Net result is that the chamber pressure will fall more and more. So more the relaxation during isovolumic relaxation phase, more will be dropping of ventricular pressure. And remember, at the end of isovolumic relaxation phase, so here I will write down again, at the end of isovolumic relaxation, the ventricular pressure will be lowest. So lowest ventricular pressure, lowest ventricular pressure, very, very important, it can be asked in MCQ. So lowest pressure in the ventricle that is reaching in which phase of cardiac cycle? At the end of isovolemic relaxation phase, that is near equal to 0 millimeter of mercury. So ventricular pressure will drop down to near equal to 0 millimeter of mercury. Now you look at, so whenever the ventricular pressure is lowest, okay, that means I can imagine here that the blood volume in the ventricle is very less and pressure is very less here, very less here. But when the ventricle was relaxing isovolemically, what was the condition of the right atrium? Right atrium was getting blood from superior vena cava as well as the inferior vena cava. So when the ventricular pressure is dropping more and more during isovolemic relaxation phase, atrium is getting huge amount of blood and the atrium is full with blood. So if the atrium is full with blood, so what will happen to the atrium pressure? I can easily understand that because the atrium is full with blood, atrium pressure will be high and that will be near equal to 7 to 8 millimeter of mercury. So for our understanding, I am writing here, suppose in this condition, the right atrium pressure is 8 millimeter of mercury, right? Normally it is 0 to 5, but suppose we are saying that 8 millimeter of mercury. So ventricular pressure is near equal to 0 millimeter of mercury. Right atrium pressure is 8 millimeter of mercury. There is a huge difference of pressure between these two chambers, and this difference of pressure will leads to opening of this tricuspid valve immediately. So getting my point, whenever at the end of isovolemic relaxation ventricular pressure is near equal to 0, atrium pressure is 8 millimeter of mercury, this will leads to opening of tricuspid valve. So I will write down this event because this is also an important event. So at the same point when the ventricular pressure is lowest, at the same point there will be opening of tricuspid valve, or I am writing atrioventricular valves. There will be opening of tricuspid valve or atrioventricular valve. Now whenever there is opening of these tricuspid valves or atrioventricular valve, what is going to happen? This is very easy to understand. What will happen? The blood will start running towards the ventricular cavity. Why it is running? Because huge amount of pressure difference. So I can now understand that the blood will run towards the ventricular cavity with a huge velocity. Rapidly the blood will enter inside the ventricular cavity. So what will happen? Gradually this ventricular blood volume will be expanded, right? And ventricular pressure, that will also increases. Suppose this pressure is 2 millimeter of mercury. Okay, so whenever the blood is running towards the ventricular cavity, I can understand that there is gradual filling of ventricular cavity, and this filling is occurring in a rapid fashion. That's why this phase after the opening of the AV valve, this phase is known as the first rapid filling phase. So this phase will be known as the first rapid filling phase. Why first? Because there is another rapid filling phase which will appear later on. That's why we have given first rapid filling phase. So during first rapid filling phase, blood is running towards the ventricular cavity because of huge pressure difference between atrium and ventricular chamber, right? The duration of this first rapid filling phase is 0.1 second. So what is happening during the first rapid filling phase? Why the filling is rapid? Because the pressure difference between atrium and ventricular chamber is very high, right? Let me color this. Okay, so life should be colorful, right? So I am coloring here. Very good. So first rapid filling phase is done. Now after the first rapid filling phase is done, I can understand that the ventricular pressure is gradually rising because more and more blood is coming, and the blood is coming from atrium. So what will happen to this atrium pressure? The atrium pressure is going to fall. So suppose the atrium pressure is now 6 millimeter of mercury and ventricular pressure is 2 millimeter of mercury. Now if I look at the difference of pressure between this atrium and ventricular chamber, earlier the difference was 8 minus 0. Okay, now the difference is 6 minus 2, so that is 4. So the pressure difference has decreased between atrium and ventricular chamber. So valve is still open, pressure difference is decreased from the previous phase. So blood will continue to enter, but this continue to enter will be in a slow manner. because of decrease in pressure difference between these two chambers. So first there will be a rapid filling phase, then there will be a slow filling of the ventricle. Why the slow filling is occurring? The slow filling is occurring because of the reduced pressure difference between atrium and ventricular chamber. So I can write down that after this first rapid filling phase, the next phase that is going to happen is a long duration phase. This phase is known as the diastasis phase of cardiac cycle, which is also known as slow filling phase of cardiac cycle. This is also known as slow filling phase of cardiac cycle. This has a duration of very high duration, 0.2 second, right? So this is known as the phase of diastasis, where the pressure difference between atrium and ventricular chamber is lesser and the blood is slowly moving towards the ventricular cavity, right? I hope you get it. Now this diastasis phase is very important. Why? Because during this phase the tricuspid valve is open, ventricle is also in a relaxed condition, atrium is also in a relaxed condition, and blood is slowly moving towards the ventricular cavity. This, because of this slow moving, diastasis is that phase where ventricular wall motion is minimum. This is an MCQ. Ventricular wall motion or movement is minimum, right? Please note down. So this is the phase where the ventricular wall is not moving at all. It is almost standstill, wall motion minimum. That is the phase of diastasis. Now again I have to look at this ventricular cavity. Okay, so at the end of the diastasis I can understand a diagram like this, that atrium and ventricle both are in a relaxed condition, the tricuspid valve is open and ventricle is filled with blood. So atrium pressure has reduced. Suppose now this is 4 millimeter of mercury. So earlier it was 6, now suppose this is 4 millimeter of mercury, and ventricular pressure has also increased to 4 millimeter of mercury. So during this first rapid filling phase and during this diastasis, ventricle has got enough of blood, and because of that the ventricular pressure has risen to 4 millimeter of ventricular pressure is now 4 millimeter of mercury. Now the atrium pressure as well as the ventricular pressure is almost equal. So now the blood cannot move from this atrium to the ventricular chamber automatically because both the pressure is same to same, right? So what the atrium has to now contract. So whenever the atrium will contract, it will give a push. Okay, this push will causes rapid entry of remaining blood from atrium to the ventricular chamber. So note down. So during the first rapid filling phase as well as during the diastasis phase, during these two phases, atrium was not contracting. Both atrium was relaxing, ventricle was also relaxing. Why the blood was moving from atrium to ventricle? Because of the pressure difference. Now the pressure of atrium and ventricle both are almost equal, right? So the blood which is still there in the atrium chamber, that is not going to move automatically to the ventricle. Someone has to kick it, and the atrium is giving that kick by causing contraction. So now the atrium will go for a contraction, that is atrium systole. We know the duration of atrium systole, that is 0.1 second. So whenever the atrium will contract, this will push the blood rapidly into ventricular chamber once again. So again there will be a rapid filling of ventricle due to atrium contraction. This rapid filling phase is known as last rapid filling phase of ventricle. If I ask you what will be the duration of the last rapid filling phase, this will be same to same with that of the atrium systole, that is 0.1 second. So please note down, this is very important phase, because during this last rapid filling phase, this is the only phase where atrium is contracting. This is the only phase where atrium is contracting. So I am marking this phase. So this is my atrium systole phase, atrium systole or atrium contraction phase. So if I ask you last rapid filling phase coincide with, your answer will be last rapid filling phase coincides with the atrium systole or atrium contraction, atrium systole or atrium contraction, right? And the duration of this phase is 0.1 second. So now if I look at the whole diastole, we have discussed 4 phases. Although there is another phases, I am coming to that. So that is isovolemic relaxation, then first rapid filling phase, then diastasis, and then last rapid filling phase. But if I ask you within these 4 phases, filling of ventricle is occurring in which phases, then obviously your answer is filling is not occurring during this isovolemic relaxation phase. No filling, because all the valves are closed. Filling is only occurring during this first rapid filling phase, diastasis, and this last rapid filling phase. Now within this filling phase, three filling phases are there. If I ask you how much percentage of filling occurs during the last rapid filling phase, so please note down. Atrium systole or atrium contraction is responsible for 25 to 30% of the total ventricular filling, right? So this means that another 70% of the filling has already been done by this first rapid filling phase and this diastasis phase. So combination of this first rapid filling phase as well as this diastasis phase, they are responsible for 70% of the ventricular filling, and this filling is known as passive filling of ventricle. This is known as the passive filling of ventricle. Now what do you mean by passive filling? If I ask you during this 70% filling, is any chamber, whether it is atrium or ventricle, are they contracting? Answer is no. Both of them are relaxing. Atrium is also relaxing, ventricle is also relaxing, but automatically filling is occurring due to atrium pressure is higher than that of the ventricular pressure. So obviously this 25 to 30% filling, this filling of ventricle is contributed by active contraction of the atrium, and that's why this is known as active filling phase of ventricle. This is known as active filling phase of ventricle. Getting my point? So active means ventricle is not contracting actively. Okay, active is meaning the active contraction of atrium is contributing ventricular filling. This is very important. I told you, okay, that last rapid filling phase is due to atrium contraction, and the filling which is occurring during this last rapid filling phase, this is known as active filling of ventricle, because it is contributed by active contraction of atrium. Right? So all the 4 phases of the diastole is described. Now if you go back to the phases of diastole, then you have seen that there is another phases which is known as protodiastole phases. Okay, so why we are discussing protodiastole at the last of the diastole discussion? Because in some of the books, particularly the cardiovascular physiology books, they are saying that protodiastole is not there in the cardiac phases. They are not describing the protodiastole, but in Genome the protodiastole phase has been given, and some of the author are also in line that protodiastole is part of the systole. That's why we are discussing protodiastole at the last. Okay, so you have to go back to this starting of the onset of diastole point again. So start of diastole. So I told you what is the condition of the right ventricle at the start of diastole. Start of diastole means that is end of systole. So ventricular chamber is fully contracted and most of the blood has been ejected. Now if I ask you, whenever the ventricle will start its relaxation, okay, what will happen? First the volume, there will be enlargement of the ventricular cavity, or first the muscle will be relaxed. Getting my point? So what I am saying, suppose this right atrium is fully contracted. Now the right atrium wants to relax. So what will happen? First there will be enlargement of this cavity, or first there will be relaxation of this muscle. Obvious thing is that whenever the muscle was contracting, there was huge amount of calcium at the level of muscles. We know the molecular mechanism, right? So you have to remove the calcium from the cytoplasm to the sarcoplasmic reticulum, and that way first of all you have to cause relaxation of this muscle. Then and then only when the relaxed muscle is enlarging the cavity, then there will be closure of the semilunar valves. Getting my point? Because I told you that closure of this semilunar valve will only occur whenever the ventricular chamber pressure is falling, and that will occur when the ventricular chamber is expanding. But before the expansion of this ventricular chamber, there will be first relaxation of the muscle at the molecular level, right? So the systole is over, blood is still going towards the pulmonary artery. Now the muscle is getting relaxed, and then the muscle will start enlargement of the ventricular cavity. So there is a time gap between starting of this muscle relaxation followed by enlargement of this cavity, and this time gap is known as protodiastole phase of ventricle. So protodiastole phase means I can understand that this is only the muscle relaxation, okay, only the muscle relaxation. Exactly, the chamber dilatation has not been started yet, only the muscle is getting relaxed, and it is part of the systole. Some book is saying why, because still the blood is going towards the pulmonary artery, right, and the muscle is taking preparation for relaxation. That phase is known as protodiastole. So I am writing here, the protodiastole phase has a very short duration, very short duration, right, and this duration is 0.04 second, okay, and this phase is known as the protodiastole phase, okay. So beginning of the protodiastole phase means it is starting of muscle relaxation, okay, it is nothing but starts of muscle relaxation, right, followed by closure of this semilunar valves. Getting my point? So if I ask you what is protodiastole, the starting of muscle relaxation followed by enlargement of the cavity of right ventricle. Whenever enlargement of cavity, there will be immediate closure of the semilunar valve. So the time gap between these two, that muscle relaxation starting followed by closure of the semilunar valve, this phase is known as protodiastole phase. I told you already that protodiastole phase means during this phase the blood is still going towards the pulmonary artery, means that's why some of the books are saying that protodiastole should be considered within the part of systole, because blood is still ejecting towards the pulmonary artery, right. So now according to Genau, protodiastole is part of the diastole, right. So now we came to know here that the 5 phases of diastole, that is protodiastole, isovolemic relaxation, first rapid filling phase, diastasis, last rapid filling phase. I hope you remember the duration. This is 0.04, this is 0.06, this is 0.1, this diastasis is the longest duration 0.2, and this is 0.1. So the total duration is 0.5 second. So this is about diastole, right. Now if I look at this cycle, okay, so now I am going at the end of this diastole, here. So at the end of the diastole, the total volume of blood which is present in a single ventricular chamber is known as end diastolic volume, EDV, end diastolic volume. All of you know. So what I am saying, that you just imagine that this is right atrium and this is right ventricle, right. So your tricuspid valve is still open and ventricle is full with blood. The total volume of blood at this condition at the end of diastole is end diastolic volume. But always remember, normally end diastolic volume, whenever I am saying that value of end diastolic volume is 130 ml, this value, this volume 130 ml, this is for a single ventricle. Remember this, 130 ml for a single ventricle. So end diastolic volume is defined for a single ventricle, right. So whenever the ventricle is filled with end diastolic volume, right, there will be a pressure also, that is known as the end diastolic pressure, because of this volume there will be a pressure in the ventricle. End diastolic pressure for right ventricle, this is 1 to 7 millimeter of mercury for right ventricle, right, okay, and for left ventricle, this is 4 to 12 millimeter of mercury, this is for left ventricle, okay. So please try to remember this information. So end diastolic volume is 130 ml, this is equal for right and left ventricle, but end diastolic pressure is not same in the both the ventricle. For right ventricle it is 1 to 7 millimeter of mercury, and for the left ventricle it is little higher, that is 4 to 12 millimeter of mercury, okay, 4 or 5 to 12 millimeter of mercury, right. So that is end diastolic volume and pressure. Now whenever the ventricle is filled with, okay, end diastolic volume, now there will be starting of systole, or now there will be starting of contraction. So look at the beginning of contraction, what are the condition of valves? The tricuspid valve is still open because the filling was happening, and what is the condition of semilunar valve? It has already been closed at the beginning of the diastole. So the semilunar valve is closed, okay, tricuspid valve is still open, and ventricle suddenly started contraction. So what will happen? Immediately the pressure within this ventricular chamber will be increasing. Okay, so whenever the ventricular pressure is increased, the first tendency of the blood is to go back towards the atrium because the valve is still open, least resistance pathway. So whenever the ventricle is starting contraction, the immediate event is that blood is trying to go back towards the atrium, and that will be prevented by immediate closure of this tricuspid valve. So again the same thing. Immediate onset of contraction means immediate closure of the valves, and which valves? Atrioventricular valve or tricuspid valve. So I can write down here that whenever the ventricle is filled with end diastolic volume, there will be onset of systole. So this is the onset of systole. An immediate event at the onset of systole is nothing but closure of atrioventricular valves. Atrioventricular valves. So I can also understand that closure of the atrioventricular valve means this is the point where the first heart sound will be created. All of you know that thing. First heart sound will be created. So immediately at the onset of systole, there is closure of the atrioventricular valve. Now you look at the ventricular chamber. So your tricuspid valve is just closed, right? And your semilunar valve is already closed, and the ventricle is contracting. So how much blood is present in the ventricular cavity? End diastolic volume. So when the ventricle is contracting with all the valves closed, do you think the volume of the blood is going to change? Answer is no. The volume of blood will remain end diastolic volume only. So during this contraction phase, because the volume is remaining same in the ventricular chamber, this phase is known as isovolumic contraction phase. So after the closure of this atrioventricular valve or tricuspid valves, the next phase of cardiac cycle that is going to happen is nothing but isovolumic contraction phase of cardiac cycle with a duration of 0.05 second. With a duration of 0.05 seconds. So this is isovolumic contraction phase. Let me color it. Relaxation. So this is isovolumic contraction phase. Now, what is going to happen at the end of isovolumic contraction phase? Very, very important. So at the end of isovolumic contraction phase, we all know that this semilunar valve is going to open because now the ventricle has to eject blood. But question is, when this semilunar valve will open up? So to open up the semilunar valve, what is the bottom line is that the ventricular pressure should be greater than pulmonary artery pressure. Right? If you think of right ventricle, this is the condition. If you think of left ventricle, then the ventricular pressure should be greater than aortic pressure. Am I clear? Right. Because whenever the semilunar valve was closed, what was the pressure at the level of pulmonary artery? We know the pulmonary artery pressure is 25 upon 10. What is the meaning? Meaning 25 is the systolic pressure, 10 is the diastolic pressure. So when the semilunar valve was already closed, what was the pressure present at the level of this pulmonary artery? 25 or 10? That I am asking. That if the semilunar valve is closed, what will be the pressure at the level of pulmonary artery? Obviously, semilunar valve closed means the pressure will remain at the lowest because blood is not coming to the pulmonary artery. So how much pressure is present at the level of pulmonary artery when semilunar valve is closed? That is 10 millimeter of mercury. Whenever the right ventricular pressure is greater than pulmonary artery pressure, that is nothing but 10 millimeter of mercury, immediately the semilunar valve will open up. Getting my point? So to open these semilunar valves, how much pressure I have to generate at the level of ventricle? That is greater than 10 millimeter of mercury. But if you look at the left ventricle, so all of you know that for left ventricle, aortic diastolic pressure is 80 millimeter of mercury. You all know that aortic pressure is nothing but our normal blood pressure, that is 120 upon 80. So for right ventricle, to open the semilunar valves or the aortic valve, how much pressure the ventricle has to gain? That is more than 80 millimeter of mercury. That's why the left ventricular pressure, whenever it is greater than 80 millimeter of mercury, the semilunar valve will open up immediately. So right ventricle is generating or gathering only less pressure, that is only 10, and left ventricle has to generate 80 millimeter of mercury pressure, and that's why the left ventricular muscle mass is at least 3 times thicker than that of the right ventricular muscle mass, because it has to gain more pressure to eject the blood at the level of arch of aorta, right? So now we have understood that what is the mechanism of opening up this valve, that the pressure in the ventricular chamber should be more than pulmonary artery pressure or aortic pressure, and then only this will leads to opening of semilunar valves. Getting my point? So opening up of semilunar valve will occur at the end of isovolumic contraction. Now if there is opening up of semilunar valve, that is no big deal. Now this is very, very easy. Why? Because now the blood is going to be ejected at the level of, so if I draw another diagram here, so now my semilunar valve is open, okay, tricuspid valve is closed, okay, now the ventricle will eject blood towards the pulmonary artery, right? So immediately after opening of this semilunar valves, the ejection is very faster, that is known as rapid ejection phase, and after some point of time the ejection becomes slower, that is known as slow ejection or reduced ejection. So if I divide this ejection phase into 2 halves, so that is one is rapid ejection phase and second one is slow ejection phase. If you look at the duration, the slow ejection phase has more duration, that is 0.15 second, and rapid ejection phase has a duration of 0.1 second, right? So combination of these 3, again you can find out that this is 0.3. So this is rapid ejection phase and slow ejection phase. This is part of ejection phase only, so I am giving a single color here, right? Now during this rapid and slow ejection phase, the total volume of blood that is going out of the ventricular cavity, okay, so you look at here, what was the total volume of blood at the beginning of systole? That was the end diastolic volume. This was the blood with which the ventricle started contraction. Now from this end diastolic volume, some portion of the blood is ejected during rapid ejection phase, some portion of the blood is ejected during the slow ejection phase, and the total volume of blood is known as the stroke volume. So stroke volume, again it is defined for a single ventricle. The normal value of stroke volume is 70 to 90 ml, right? The 2/3 of 70 to 90 ml, the 2/3 of stroke volume is ejected during the rapid ejection phase, and 1/3 of the stroke volume is ejected during the slow ejection phase. So if you look at the duration of the slow ejection phase is more than that of the rapid ejection phase, but most of the blood, that is 2/3 of the blood is ejected during rapid ejection phase and 1/3 of the blood is ejected during the slow ejection phase, and the combination of these two, rapid and slow ejection blood volume, is known as the stroke volume of the ventricle, which is generally 70 to 90 ml. So end diastolic volume was 130 ml, okay, end diastolic volume was 130 ml. From that 130 ml, ventricle has ejected only 70 to 90 ml during ejection. So I can easily understand that 130 minus this 90, okay, that means at least 40 ml blood is still remaining within the ventricular chamber even at the end of systole. So I can understand here, okay, point out which point is the end of systole. So this is the point which is indicating end of systole or end of ejection. The volume which is still remaining at the ventricular chamber, this is known as end systolic volume. Getting my point? So end systolic volume is that volume of blood which is still remaining in the ventricular chamber even after the ejection is completed. And what is the approximate value? The end systolic volume is nothing but EDV minus stroke volume is equal to your end systolic volume, and that is approximately 40 ml. Now with this end systolic volume, okay, what is next going to happen? Next we know, next this protodiastole phase will start. Protodiastole is nothing but muscle relaxation. After protodiastole, again this isovolumic relaxation is going to start, and I already told you that isovolemic relaxation means the ventricular blood volume is not going to change during this phase. So if I ask you, what is the volume of blood present in the ventricular cavity during isovolemic relaxation phase, your answer will be this is nothing but end systolic volume, sir. So with end systolic volume, we had started our discussion from here that at the end of systole, what is the condition of this right ventricle? The right ventricle is fully contracted. Okay, the tricuspid valve is closed. The little amount of blood is present in the ventricular chamber. Now you came to know what is the name of this blood. This is nothing but end systolic volume, which is approximately 40 ml. Right? With this 40 ml blood, whenever the ventricle will start its relaxation, immediately the pressure within the chamber will drop down, and this part we have already discussed. This will leads to immediate closure of this semilunar valves, and that will leads to starting of isovolemic relaxation phase. Getting my point? So now if you look at this diagram, now this diagram is looking very beautiful with multiple colors, and all the phases of cardiac cycle has been discussed. So after looking at this diagram, if I ask you why we are discussing ventricle only during cardiac cycle, what about atrium? Look at atrium will contract only once, and that is corresponding with which phase of cardiac cycle in the ventricle? That is the last rapid filling phase. Getting my point? So atrium will contract only during this phase. Now if I ask you what is the condition of atrium in all other phases of cardiac cycle, if I ask you what is the condition of atrium during this isovolemic contraction, rapid ejection, isovolemic relaxation, first rapid filling phase, diastasis, what is the condition of atrium? Atrium is doing nothing. Atrium will remain in a diastolic condition during all these phases. Atrium will only contract during last rapid filling phase. So basically you know that this will go on like this. Atrium will contract and then it will relax slowly. By the time ventricle will contract, again relax. Again atrium will give a push, then atrium will go for relaxation. By the time ventricle will contract, relax. Again it will give a push and start relaxation. Then the ventricle will contract and relax. This way the cardiac cycle is going on, and you have to look at the ventricular event rather than that of the atrium event, because atrium event is only contraction for 0.1 second and then relaxation. Getting my point? So this way you have to read about cardiac cycle. So now if you look at the systolic phases, okay, isovolemic contraction, what is the duration? 0.05 second. Rapid ejection, I told you duration is shorter, but most of the blood is ejected during this phases, and the slow ejection phase, the duration is prolonged, so the total duration is 0.3 second. So this is all about different phases of cardiac cycle described with the help of this diagram. I hope all of you get it. Okay, right? Okay, now after the discussion of this cardiac cycle, you have to look at the point where the first heart sound and second heart sound will be created, right? So I'm writing here, my question is, tell me in which phase of cardiac cycle the first heart sound is going to be created, the first heart sound, right, and the second heart sound. Okay, so could you recall this whole picture? That is very important, because now many things will be discussed in this class as well as in the next class, which is related to the cardiac cycle. So all these phases should be on your fingertip. If I ask you what is happening, what will happen to the pressure, you have to answer. So if you look at the first heart sound, I told you that is nothing but closure of the atrioventricular valve, and it is written here, closure of the atrioventricular valve. So you can point out that this is happening at the end of diastole, or you can say this is happening at the beginning of isovolemic contraction. So what should be the better answer? End of diastole, or end of this last rapid filling phase, or beginning of isovolemic contraction? Always remember, if the ventricle is stop contracting at the end of diastole, first heart sound is not going to happen, because I told you earlier that whenever ventricles start contraction, then and then only the blood will try to return back towards the atrium cavity, and that will leads to closure of the tricuspid valves. So onset of contraction will leads to closure of AV valves, right? So I'm writing here, so first heart sound will start at the beginning, okay, at the starts of isovolemic contraction. Similarly, if you look at the second heart sound, see, second heart sound is due to closure of the semilunar valve here. This is the second heart sound point, closure of the semilunar valve. So where it is happening? At the end of protodiastole, but I told you protodiastole, forget about protodiastole. So at the end of systole or beginning of diastole. But again, which you have to answer, beginning of diastole will be your answer, because if the heart is stopping at the end of systole, then the second heart sound is not going to happen. Whenever the ventricle will start relaxation, the chamber relaxation means the blood will try to fall back from pulmonary artery towards the ventricular cavity, and that will leads to closure of the semilunar valve. So I am writing here that second heart sound will appear, okay, at the starts of isovolumic relaxation phase, right? So first heart sound beginning of isovolumic contraction, second heart sound beginning of isovolumic relaxation. All of you know that there are many other differences between these two heart sound. Second heart sound, you remember like this, that S for second, S for short. Short means it is shorter in duration. The duration of this heart sound is 0.12 second is the duration of this sound, very small duration sound, okay. Then sharp. Sharp means the frequency, the pitch of the sound is very, very high. Frequency of the sound, you know, the sound wave means there will be an amplitude, there will be an frequency. So sharpness means the frequency is 50 hertz. This is known as the high pitched sound, right? And it is also a soft sound. Soft means the decibel, okay, the decibel or the amplitude of this sound, amplitude of the second heart sound is low. So low amplitude sound, right? So these three things you have to remember about second heart sound. On the other hand, if you look at the first heart sound is just opposite. So it is a longer duration. Longer duration means it is not very huge long than that of the second heart sound. This is only 0.15 second, right? So second heart sound duration is only 0.12 second. It has been asked in MCQ. First heart sound duration is little longer than that of the second heart sound, that is 0.15 second. Then second is it's a low pitched sound with a frequency of 25 to 45 hertz. So 25 to 45 hertz, it is audible frequency. Yes, obviously it's an audible frequency. So that's why we can easily hear the first and second heart sound. And then it is a loud sound, L-O-U-D. Loud means it is a large amplitude sound, right? So this way you have to remember the difference between this first and second heart sound. Now, if I ask you that is there any correlation of this heart sound with the ECG, means if I want to correlate that in which phase of ECG which heart sound is going to produce, then the concept is like this. Suppose I am drawing a normal ECG, we have discussed in the previous session, right? So this is QRST, okay. So this is my T wave, right? So look at first heart sound. We are first thinking like this. First heart sound means onset of ventricular systole. You told me earlier that it is the isovolumic contraction. So ventricular contraction has to be started. Ventricular contraction means first of all there should be starting of depolarization. Always remember, please don't forget that I told you that if this is your action potential, okay, it correlates with the ECG. Action potential phase 0 means the QRS complex will corroborate with this, right? I told you in the earlier session. Now, calcium enter only during this phase 2. That means first there will be starting of the electrical event, and then only calcium will influx into the cell, and then only the contraction and relaxation will start like this. Getting my point? So this action potential, this black color diagram, look at this action potential is known as the electrical event, and this red color diagram or graph, this is the contraction followed by relaxation, means this is the mechanical event. Mechanical event means this part is the systole and the remaining part is the diastole. So what we are understanding from here, that always the electrical event happen first, and then only the mechanical event is going to happen. This is true for every muscle. First you require action potential. Okay, then only the contraction, the mechanical contraction, the relaxation is going to start, right? So now we all know that first heart sound means ventricular contraction has to be started. So contraction means I require ventricular depolarization. Ventricular depolarization will be started from which wave? That is the Q wave in the ECG. So do you think the Q wave is going to cause full contraction of the ventricle? Answer is no. Q wave is only septal depolarization. So after the Q wave generation, when the R wave is starting, right, then and then only the ventricle is going to cause full contraction. That means the first heart sound will never appear during this Q wave. It will appear when the R wave is going on, and it is said in the books that the peak of this R wave, this is the point where the first heart sound is going to appear, right? So please note down this important concept. So first heart sound means it is the peak of R wave, right? So similar way, you think of the second heart sound. Second heart sound means this has to happen during the full relaxation. Okay, now you look at here. What is happening? First the electrical relaxation is happening or the mechanical relaxation is happening? First the electrical relaxation, that is the repolarization, has to happen, and then only the ventricular muscle will relax fully. So second heart sound means we all know that will happen during the beginning of relaxation of the ventricle. Relaxation means first electrical relaxation has to be done. Electrical relaxation means this is nothing but repolarization. Repolarization nothing but T wave. So at the end of T wave, I can understand that the second heart sound is going to appear. Getting my point? So the first heart sound corresponds with the peak of the R wave, and second heart sound corresponds with the end of the T wave, right? Now what about third and fourth heart sound, right? Because we know apart from first and second, third and fourth heart sound is also there. So third and fourth heart sound, both of this heart sound occurs due to vibration of the ventricular wall or due to the vibration of the blood which is present in the ventricular cavity. What I am saying? Okay, suppose your ventricle is in a relaxed condition and ventricular filling is going on. If you go back to this cardiac cycle diagram, see, ventricular filling is occurring during this first rapid filling phase also, during this last rapid filling phase also. During diastasis, the ventricular filling is occurring, but that is very slow. If the ventricular filling is slow, then the ventricular wall is not going to vibrate. Ventricular wall vibration means the filling has to be rapid. So there are two rapid phases. First rapid filling phase and last rapid filling phase. So third and fourth heart sound, third heart sound is going to appear during first rapid filling phase of the cardiac cycle, and fourth heart sound is going to happen during last rapid filling phase of cardiac cycle. Why? Because during these two rapid filling phase, what is going to happen? There will be vibration of ventricular wall. There will be vibration of ventricular wall as well as the column of blood which is present in the ventricular chamber, and that vibration will leads to production of sound. Getting my point? Sound means there should be some vibration. First and second heart sound was due to vibration of the valves. But here this is not due to vibration of the valves. This is due to vibration of the ventricular wall as well as the volume of blood which is present in the ventricular chamber. Why there is vibration? Because rapid filling occurring inside the ventricle. Now if I ask you, what will be the duration of both of this sound? If you look at the duration of this first rapid filling phase, last rapid filling phase, then you will be able to answer that both of this phase has same duration, that is 0.1 second is the duration of the third heart sound, 0.1 second is the duration of the fourth heart sound. That means both of this heart sound has the same duration, that is 0.1 second. If I ask you what is the pitch, what is the frequency of these two sound, frequency of both of this heart sound is approximately 10 Hz, approximately 10 Hz. So do you think 10 Hz frequency means are these sounds audible? Answer is no. 10 Hz means we know our audible frequency is from 20 to 20,000, right? So 10 Hz frequency means this is inaudible. That's why we say third and fourth heart sound, normally it is not heard over the precordium region. If you put stethoscope on a normal adult person, third and fourth heart sound, they are not audible, right? But there are certain condition where audible third heart sound is seen. When the third heart sound will be audible? When the frequency is increased to approximately 30 Hz, okay, then and then only the third heart sound will be audible. What will be the causes? Causes are hyperdynamic circulation, right? And second is increase blood filling or increase volume of blood in the body. What I'm saying, third heart sound will be audible when the frequency increases from this 10 Hz to 30 Hz approximately. And when this is going to happen, when the blood is flowing inside the cavity of the heart in a higher velocity, that is meaning the hyperdynamic circulation. Blood is running with a high velocity. So during the first rapid filling phase, blood was running towards the ventricular cavity. Now due to huge velocity, the running is increased towards the ventricular cavity. So more faster running of blood towards the ventricular cavity, that will cause more vibration, and that is the meaning of hyperdynamic circulation. What is the example? All of you know that in case of children, because of the heart rate is very, very high, okay, so in case of children, okay, heart rate is very, very high, that will also produce hyperdynamic circulation. In case of anemia, okay, hyperdynamic circulation can be seen. In case of thyrotoxicosis, okay, in case of hyperthyroidism, again hyperdynamic circulation can be seen. So during all these conditions, children, anemic person, okay, hyperthyroidism, you can get the third heart sound. And when the increased blood volume is there, typically this is seen in during congestive cardiac failure patient, the blood volume is very, very high, and that can also leads to audible third heart sound, right? That is a pathology of audible third. Similarly, if I ask you what is the cause of audible fourth heart sound, right? Audible fourth heart sound means again the frequency of this heart sound will be near equal to 30 Hz, right, from 10 Hz, and the cause here is increased stiffness of the left ventricular wall, increase stiffness of ventricular wall, okay, ventricular wall. What I'm saying, ventricular wall, okay, whenever the blood is running towards the ventricular cavity, there is vibration normally, but that vibration frequency is less. But if the ventricular wall becomes stiffer, then this last rapid filling phase will produce more vibration of this stiffer wall, right? If a soft surface and a hard surface, if you give same amount of pressure, which will produce more sound, the hard surface, the same thing is happening on the ventricular wall, right? That's why due to any condition, if there is increased stiffness of the ventricular wall, that can lead to audible fourth heart sound. The typical example is fibrosis of the ventricle after myocardial infarction, post myocardial pressure, fibrosis of the ventricular wall, or if there is hypertrophy of the ventricular wall, that sometimes also causes increased stiffness of the ventricular wall. In this condition, the audible fourth heart sound you are going to get, right? So at the end, what is the cause of third heart sound? That is occurring during first rapid filling phase. What is the cause of fourth heart sound? That is occurring during last rapid filling phase. We have already understood that last rapid filling phase is due to atrium contraction. So last rapid filling phase is the active filling of ventricle, and it is occurring during atrium contraction. So if I ask you, atrium contribution leads to appearance of which heart sound? Your answer is fourth heart sound, because that is corresponding with the last rapid filling phase, right? So now with this concept, if I go back to this ECG diagram, okay, so this is one ECG, I am drawing another ECG here. So again a P wave, again a QRS complex like this, P wave. Fourth heart sound, think of fourth first, then you will go back to the third heart sound. So fourth heart sound is due to atrium contraction, right? Atrium contraction means you require atrium depolarization. Atrium depolarization is denoted by which wave? P wave. So first the depolarization of the atrium will start. At the end of atrium depolarization, atrium will contract, and that will leads to fourth heart sound. So this is the point where fourth heart sound is going to be created. So now I can understand, we have find out the point where first heart sound is occurring, second heart sound is occurring, and fourth heart sound is occurring. So obviously in between this second and fourth, within this isoelectric line, or you can say TP segment, this is the TP segment or this isoelectric line, this is the point where third heart sound is going to be created, right? So this is the heart sound and ECG correlation. And this is all about the different phases of cardiac cycle that we have discussed. Now our job is not done. Now our job is to discuss the change in pressure during cardiac cycle. Okay, so now we have to discuss that during this cardiac cycle, different phases of cardiac cycle, how the atrium pressure is changing with different phases of cardiac cycle, right? If you look at the atrium pressure change, then you will find out a pressure changing curve like this. So what is this? So this is nothing but typically your very famous the jugular venous pulsation, right? So this is the nothing but atrium pressure changes. If you look at the ventricular pressure changes, you are going to get a curve like this. Okay, so you are going to get a curve like ventricular pressure changes like this. Okay, so sudden rise of ventricular pressure followed by sudden fall of ventricular pressure. So this is ventricular pressure change. And if you look at the aortic pressure change, so we are now looking at the left ventricle. Aortic pressure change will look like this. Okay, so this is nothing but aortic pressure change. So all these three different curves we have to understand for our MCQ purpose. And if you plot all these three curves in a diagram, that diagram is known as Uyghur's diagram. So what I am saying, this is known as Wiggers. Uyghur's. The name of the scientist is Uyghur's. Uyghur's plotted all these three curves along with ECG and other parameter on y-axis in a curve, and the x-axis is time. So when you are plotting all these three curves on y-axis along with other curve also like ECG and other things, and x-axis is time, and you are plotting with respect to cardiac cycle phases, that diagram is known as Uyghur's diagram. Now we are going to discuss this Uyghur's diagram, that is the pressure changes during cardiac cycle, right? So what I require to draw certain line first. Okay, so this is first line. Okay, so I told you that x-axis of this curve is nothing but time axis, and y-axis of this curve is nothing but the pressure axis, right? So x-axis is time and y-axis is pressure. So what about this line? Okay, so these lines are nothing but the time gap between these first two lines. This is the phase of isovolumic contraction. See, so we are describing the cardiac cycle only, but pressure change in cardiac cycle, different type of pressure change, atrium, ventricular is a pressure, right? So isovolumic contraction. Then next, the time gap between these two, this is the ejection phase of cardiac cycle. This is the ejection phase of cardiac cycle. Ejection phase is nothing but the rapid ejection phase and slow ejection phase, right? So rapid ejection and slow ejection. And then this time gap between these last two lines, this is obviously isovolumic relaxation. We are ignoring the protodiastole phase here because that has no clinical significance, right? So this is isovolumic relaxation, right? Now during these different phases, we want to plot the ventricular pressure. So look at this red color point, this will denote the ventricular pressure. So I am writing here ventricular pressure with red color, right? And I will take another color, suppose this is green color, this is aortic pressure. Okay, this kind of diagram is also plotted in clinical medicine also. That's why we are plotting the left ventricular pressure volume curve, time curve rather than right ventricle, because that has more clinical significance, right? So now I am trying to understand that during isovolumic contraction, okay, so first phase is here, the isovolumic contraction. During isovolumic contraction, what will happen to ventricular pressure, what will happen to aortic pressure, right? So isovolumic contraction means, okay, beginning of isovolumic contraction, all of you please note down, the beginning of isovolumic contraction means this is the end of diastole and beginning of systole. So end of diastole means, if I ask you what will be the pressure in the ventricular cavity, end diastolic pressure in the left ventricle, could you answer? end diastolic pressure. So if I ask you that what is the pressure at this point, this is nothing but end diastolic pressure. If I ask you how much that is I told you already 5 to 12 or 4 to 12 millimeter of mercury. So this is around 4 millimeter of mercury, suppose, right? Okay, so this is the pressure at the end of diastole. This is the pressure at the beginning of isovolemic contraction. Now I am asking you, what is the pressure at the level of arch of aorta at the beginning of systole? That will be the diastolic pressure, and that will be 80 millimeter of mercury. That's why you look at, I have plotted the aortic pressure to a higher point, that is the high pressure, 80 millimeter of mercury, and ventricular pressure is 4. Now, whenever the ventricle will contract during this isovolemic contraction, the ventricular pressure will gradually rise like this, Ultimately, what is the target? Ultimate target is that during this isovolemic contraction, ventricular pressure has to be more than aortic pressure. Then and then only there will be opening up of the semilunar valve, we have discussed earlier. So that's why I was talking about that cardiac cycle phases you have to understand first, okay, to look at the pressure volume changes. Okay, so during this isovolemic contraction, the ventricular pressure is rapidly rising. During this rapid rise of ventricular pressure, aortic pressure will not changes much, so aortic pressure will remain same. But you look at this point, which point? Here, okay, the point on the second line. At this point, due to contraction of the ventricle, the ventricular pressure is going above aortic pressure. Ventricular pressure is increasing more than aortic pressure. So what is going to happen? All of you will be easily answer here that one event is going to happen here, and that is nothing but opening of aortic valves, right? So this is the point where aortic valve will open up. Now whenever the aortic valve is opening up, what will happen? The ventricle will eject blood to the arch of aorta. So ventricular pressure will also go on increasing during this phase. Why? Because ventricle is still contracting, na? So ventricular pressure is still increasing, right? And ventricle is ejecting blood to the arch of aorta. So what will happen to the aortic pressure? Aortic pressure will also rise proportionally. So aortic pressure will also rise during this phase. But look at this two curve. Aortic pressure is below the ventricular pressure. That's why the blood is going out, right? So aortic pressure and ventricular pressure both are rising proportionally, but aortic pressure is still little lower than that of the ventricular pressure. That is during the early stage of ejection. Now, whenever the ventricle is contracting more and more, ejection is going on. Now the ventricular pressure will start falling. So now the ventricular pressure curve will start going down like this. Now the ventricular pressure is start falling, right? What will happen to the aortic pressure? Aortic pressure will also fall, but look at the curve here. Aortic pressure is also falling proportionally, but now the aortic pressure is little above the ventricular pressure. Oh my God. So this is the phase of ejection. Aortic pressure is more than ventricular pressure, but still the ejection is going on. How that is possible? Aortic pressure is more than ventricular pressure, so blood should fall back. But during the later half of ejection, particularly during the slow ejection phase, the aortic pressure is becoming more than that of the ventricular pressure, but still the ejection is going on. This is due to momentum of the flowing blood. Getting my point? You know the momentum meanings. You have pushed the volume of blood, and that blood is going towards the aorta with a momentum. Okay, although the ventricular pressure is lower than that of the aortic pressure, but still due to the momentum, the blood is still going towards the arch of aorta. And that's why, look at this two curve. Okay, both the curve are going on proportionally, but during the rapid ejection phase, ventricular pressure is more than aortic pressure. During slow ejection phase, aortic pressure is little more than ventricular pressure, but still the ejection is going on due to momentum of flowing blood. But this momentum will not continue for long. We all know that. So what will happen? Ultimately, one point will reach where this momentum of the flowing blood is reduced. So this is the point. Now the ventricular pressure is very, very lower than that of the aortic pressure, and momentum of the blood is lost. So now what is going to happen? Now the blood will try to fall back from the arch of aorta towards the ventricular cavity, and we all know that that will be prevented by immediate closure of this aortic valve. So this is the point where closure of aortic valve is going to happen. Getting my point? So this is the second point. Again, you have to remember, very important, that aortic valve is going to close when the momentum of the flowing blood is finished and the ventricular pressure is lower than aortic pressure. Now what is going to happen? Whenever the aortic valve is closed, that means semilunar valve is closed, now there is starting of isovolemic relaxation. So isovolemic relaxation, what happens to the ventricle during isovolemic relaxation? Ventricle will relax more and more, due to which the ventricular pressure will fall to near equal to 0 millimeter of mercury. So I will plot that curve. So now the ventricular pressure will fall, rapid falling of pressure. And if you look at this fall of pressure will continue to a lowest level of ventricular pressure, that is near equal to 0 millimeter of mercury. If you plot this now, so this point is even lower than that of the starting point of 4 millimeter of mercury, because this pressure is near equal to 0 millimeter of mercury pressure. And I told you that this is the point where the filling of ventricle will start once again. This is the point which is the point where ventricular pressure is lowest. And what event is going to happen? Here there will be opening of the mitral valve or tricuspid valve, and whenever the mitral valve and tricuspid valve is opening, again the ventricular filling will start and the ventricular pressure will start rising once again, right? So this is the part where the ventricular pressure is start rising once again. This is what phase? This is nothing but the filling of ventricular phase. This is nothing but filling phase of ventricle, passive filling followed by active filling. Getting my point? The ventricular pressure will start rising once again. So that's why I told you earlier, if you look at the ventricular pressure curve, it will rapidly go upward and then it will slowly rapidly come back, and then slowly it will rise like this. This is the typical ventricular pressure curve, right? Now you look at the aortic pressure curve. You follow the green line. So you have seen that during the closure of the aortic valve, the aortic pressure, what will happen after this point? The aortic pressure will rise a little bit, and then the aortic pressure will be stabilized at diastolic pressure. So this is nothing but diastolic pressure. The aortic pressure will be stabilizing, but before stabilizing, what I told, there is a little rise of aortic pressure. This is again very important. So now I am asking you, please look at the aortic curve, that is the green color line. Okay, green color line. So if you follow this, there is flattening of pressure, no rise of pressure. Suddenly there is rise of pressure during opening of semilunar valve. Then there is dropping of pressure. Whenever there is closure of the semilunar valve, again there is a little rise, and then there is stabilization of the pressure. This is typical aortic pressure curve. Very important. Look at here. This is rising, then decreasing, a notch, then a little rise, and then stabilization. This is typical of aortic pressure. So if I only draw this, okay, only draw this aortic pressure, okay, so where I will draw, okay, I will draw here. Now I am drawing only the aortic pressure. Very important to understand, right? You are getting a curve like this. Okay, so this is aortic pressure curve. Aortic pressure curve. Aortic pressure curve is typically recorded at the level of carotid artery by placing one carotid pressure transducer. So if I place one carotid pressure transducer, okay, then you are going to record this kind of curve. This is pressure changes at the level of carotid artery, which is nothing but reflection of the aortic pressure changes. If you record the pressure changes from any peripheral artery like radial artery, you are also going to get similar kind of curve, but in a distorted fashion. The peaks and the pressure will be a little different, but the shape will be maintained. But if you look at the level of capillaries, this kind of peaks are very faint, right? But what I am saying, that if you record this pressure changes at the level of carotid artery, you are finding out that there is increase of pressure, rapid increase of pressure, and then the aortic pressure or carotid pressure is reaching to a peak point. This peak point is nothing but our systolic blood pressure point. The maximum pressure during ejection of the blood, okay, at the level of aorta is nothing but systolic blood pressure, and I told you this portion, the pressure where it is the aortic pressure is stabilizing, this is nothing but my diastolic blood pressure. Okay, right, lowest pressure point at the level of arch of aorta. But when the blood is ejected at the level of arch of aorta, ejection is starting from which point? This is the point where the ejection is starting. So this is the point where ejection is starting due to opening up of the aortic valve. There is rapid rise of aortic pressure. This rising phase of aortic pressure is known as percussion wave. This is known as percussion wave in aortic pressure curve. Very, very important for MCQ. Percussion, P-E-R-C-U-S-S-I-O-N, percussion wave. Then after the blood is ejected, now the aortic pressure is start falling. So now the aortic pressure is start falling, right? During this falling phase also, you may get a little elevated point. You may get a little elevated point. Sometimes this wave is known as the tidal wave. Okay, sometimes this is known as the tidal wave in the aortic pressure curve or carotid pressure curve. What is the meaning of this? Meaning is this: suppose this is left ventricle and this is arch of aorta. Whenever you are ejecting blood at the level of this arch of aorta, right, what will happen? Arch of aorta contains huge amount of elastic tissue. So there will be expansion of this arch of aorta. Along with that, the blood which is ejected, that will be reflected back from this aortic valve, little reflected back. So due to this reflection back, reflected waves, what will happen? The aortic pressure may rise a little bit. This is known as reflective wave, and this reflective wave is nothing but the tidal wave. So if I ask you that what is the cause of this tidal wave generation, this is nothing but known as reflective wave from aortic valve, right? Reflective wave, that is tidal wave. So what is the cause of this percussion wave? All of you know the percussion wave is nothing but due to ejection of blood in the arch of aorta. Now we know this thing. Okay, now we will look at this diagram once again. Okay, so you have ejected blood, the arch of aorta is expanded. Now your ejection has been reduced. So during the slow ejection phase, the ejection is gradually reducing. So what will happen? The aortic pressure will be higher than that of the ventricular pressure. Whenever the aortic blood is trying to come back towards the ventricular cavity, we have already seen that this will lead to immediate closure of this aortic valve or semilunar valve. After the closure of this semilunar valve, what is going to happen? Okay, so the aortic pressure was falling. Suddenly the semilunar valve is closed. Whenever there is closure of the semilunar valve, it will lead to production of this notch. So this notch, which is due to closure of aortic valve is known as dicrotic notch. Getting my point? So dicrotic notch is nothing but it is the closure point of the semilunar valve or closure point of the aortic valve, right? So pressure in the arch of aorta is falling, suddenly there is closure of the semilunar valve and that is producing a notch. But after the closure of the semilunar valve, the already expanded arch of aorta will return back towards the baseline. So if I just remove this, okay, I told you that during ejection the arch of aorta is expanded. Now the arch of aorta will return back towards the original position. This is elastic recoiling, right? Whenever there is elastic recoiling, the semilunar valve is already closed. So there will be some generation of pressure at the level of this arch of aorta. This will increase aortic pressure, and that increased aortic pressure is detected by this aortic pressure curve, and that is here. So this rise of pressure after this notch or after this closure of the aortic valve, this is known as dicrotic wave. This is known as dicrotic wave, and this dicrotic wave is due to elastic recoiling of aorta. Okay, recoiling of aorta and major vessels, right? And after this elastic recoiling is done, now the pressure in the arch of aorta will gradually fall to the diastolic blood pressure line. right? So now I hope all of you get to know different waves in the arch of aorta pressure or the carotid artery pressure. So basically bottom line is that the aortic pressure curve or the carotid pressure curve looks like this, okay? Mainly it is the dicrotic notch followed by a dicrotic wave, right? So this is dicrotic notch. Sometimes you may get a reflective wave here, that is known as the tidal wave, right? And I told you this rising phase of the aortic pressure curve, this is known as the P wave, then this is tidal wave or T wave, and this is the dicrotic wave or D wave, right? Sometimes this percussion wave is also known as the anacrotic limb. This is known as the anacrotic limb of the aortic pressure curve, and this limb is known as the dicrotic limb of the aortic pressure curve. This is known as the dicrotic limb of the aortic pressure curve because the dicrotic notch is there. Getting my point? So I told you that this wave, this is due to changes in the pressure at the level of arch of aorta, which can be easily detected by carotid pressure transducer. So basically this is carotid pressure pulse. Okay, by identifying or by recording this pressure pulse from the arch of aorta or carotid artery, you can also diagnose certain abnormal pulsation, and that we are going to discuss here. So look at, this is the diagram I have taken from Harrison, the same diagram that we have discussed earlier, okay, that is the aortic pressure curve or the carotid pressure curve. So you can find out here, this is the P wave or the percussion wave, right? Okay, before that S1 has already been created, right? Okay, and then this is the dicrotic notch pointed out here, this is dicrotic notch. So I can understand that from this onset of this wave up to this dicrotic notch, this is nothing but phase of systole, and after the dicrotic notch, the remaining portion is nothing but the diastole during the diastole. I hope this is clear, because closure of the semilunar valve means after that, that is diastole, right? So this during this diastole, the dicrotic wave is created, okay, and this percussion wave and tidal wave, they are part of the systolic wave. This is a normal pulse which is recorded from carotid artery region, right? Now if you are getting the slow upstroke of this P wave, so I can understand that if the ejection is not proper, during ejection if there is certain kind of problem, right? So what is going to happen? The ejection is problem means what is going to happen? There will be slow upstroke of the percussion wave, and that is known as the anacrotic pulse. So anacrotic pulse, right, it is nothing but slow upstroke of the P wave. So you can get here that P wave is not smooth, okay, the P wave is not smooth, slow upstroke, and obviously the peak of this P wave is also not reaching to the normal level, and that typically happen in case of aortic stenosis. Because this is affecting the anacrotic limb of the pulse is also known as anacrotic pulse. Now if you are getting two peak, one is during this ejection phase, that is due to the P wave or the percussion wave, and another prominent peak which is due to the dicrotic wave, which is during diastole, okay. So this is happening during diastole, and another peak, this is during systole. So this kind of pulse, when you are getting one peak during systole, one peak during diastole, which is appearing after dicrotic notch, that kind of pulse is known as dicrotic pulse, which is typically seen in case of low volume, low cardiac output condition. Low cardiac output condition mein this you are going to get this kind of pulse. But if you are going to get two peaks and both the peaks are appearing during systole, right, so that kind of pulse will be known as Bispherians pulse. Bispherians pulse, what do you mean by that? You are getting one peak here due to the P wave and another very prominent peak that is due to the T wave. So I can understand that P wave is also prominent, tidal wave is also prominent. Tidal wave also prominent means your reflective wave from the arch of aorta is becoming very prominent, and that is known as the Bispherians pulse. But both the peak you are getting during the phase of systole. So Bispherians pulse you can get during the severe aortic regurgitation also, or you can get during hypertrophic obstructive cardiomyopathy also, HOCM. So you can get during severe AR or HOCM patient Bispherians pulse. One peak is due to P wave, one peak is due to T T wave or tidal wave. That is different types of abnormal pulse you have to read, right? So now we have understood this aortic pressure wave and ventricular pressure wave we have understood. Now our job is to understand the changes in the pressure at the level of this atrium. So atrium pressure changes. So atrium pressure changes means this is nothing but typically the description of the jugular venous pulsation. Okay, so you all know that whenever you say JVP, okay, that is nothing but reflection of the right atrium pressure, right atrium pressure. Okay, if you record the pressure changes from the left atrium, similar kind of wave will be seen. Okay, what I am saying, first try to understand. If I record the pressure changes from right atrium, I am going to get a curve like this, okay, which will be known as ACV wave. I'll discuss. And if you are going to record the left atrium pressure also by some means, left atrium pressure is generally recorded by a technique which is known as pulmonary capillary wedge pressure. Pulmonary capillary wedge pressure. This is a technique by which left atrium pressure is recorded. You will also get a pressure changes of left atrium like this, where you are going to get ACV wave similarly, right? But the difference between these two, right atrium wave and left atrium wave, is that in case of right atrium wave, A wave is the dominant one. So I am writing here A dominant, right? And in case of left atrium pressure change, if you record, this is V wave dominant. So here the V is the dominant wave, right? The reason is because of this, the left atrium is a stiffer, harder chamber than that of the right atrium, because of which the V wave is the more dominant in case of left atrium pressure changes, and A wave is the more dominant wave during the right atrium. Otherwise, you are going to get the similar kind of wave in both the atrium. So, if you record the pressure from right atrium, okay, what are the different waves that you are going to get? Okay, so A wave, C wave, and then you are going to get a V wave, right? So x-axis, this is the time axis we have already discussed, and y-axis is the pressure axis. But which pressure we are recording? We are recording the atrium pressure. So you are getting some positive wave, A wave, C wave and V wave. These are known as a positive wave. So I am writing here positive wave in the right atrium pressure, A, C and V. And then you are also getting some negative wave, like here this is X, then this is X dash, okay, and sorry, this X dash I should write clearly, this is X dash, and then this is Y descent, right? So when the waves are going towards a lower direction, that is the negative or descent. So I am writing here, these are the negative waves. Negative waves, they are X, X dash and Y. Negative wave are also known as descending wave, right? So remember like this, A means atrium contraction. So A wave is due to atrium contraction. A wave is due to atrium contraction. We are looking at the right atrium pressure changes. So try to imagine a diagram like this. This is your right atrium and this is your right ventricle. Okay. Now we are looking at the atrium chamber. So A wave is due to atrium contraction. So when the atrium is contracting, so it is very obvious that the atrium pressure will rise to a very high level, and that rise of atrium pressure during atrium contraction is nothing but the A wave. Getting my point? So A wave is due to atrium contraction. Now if I ask you, A wave is produced in the right atrium pressure wave, but which phase of cardiac cycle is going on during A wave? So your simple answer, A wave means atrium contraction. Atrium contraction correspond with last rapid filling phase of cardiac cycle. Am I clear? This is very important, because nowadays they will give question combination of this thing. Okay, so last rapid filling phase correspond with atrium contraction. So whenever there is atrium contraction, atrium pressure is rising, that you are getting at the level of A wave. And if you look at the ventricle, last rapid filling phase is going on in the ventricle. Okay, means the blood will reach to the ventricle during this A wave. Okay, now after this atrium systole, okay, so now atrium is contracted. Now what is going to happen? Now the atrium will go for relaxation. So whenever is atrium is going for more and more relaxation, what will happen to atrium pressure? Atrium pressure will start dropping down. So now the atrium pressure will start dropping down. So during atrium relaxation, the atrium pressure will start dropping down, and this dropping down of pressure is here. So this drop down of pressure is known as the X descent or X wave. So X wave, I am writing the cause of this X wave is relaxation of the atrium chamber. Relaxation of atrium chamber. Now I can understand that during this X descent, ideally the wave should fall or reach back to the baseline. Atrium pressure should reach to the lowest point during this point, but that is not happening. Suddenly there is appearance of a notch, followed by there is appearance of a positive wave once again, positive wave once again. Why this is happening? To understand that, you have to look at the ventricular chamber, right ventricle. So this is my right ventricle. Atrium contraction is over, last rapid filling phase is over. After the last rapid filling phase, we all know the total volume of blood which is present in the ventricle is end diastolic volume. After the end diastolic volume, what phase of cardiac cycle will start? The ventricle will start contraction, and that phase is known as isovolumic contraction phase. So isovolumic contraction phase means at the beginning of this isovolumic contraction phase, what is going to happen? This tricuspid valve is going to closed, and then the ventricle will contract. More and more contraction means there will be increase in ventricular pressure. When the ventricular pressure is increasing, what will happen to these tricuspid valves? These tricuspid valves will bulge towards the atrium cavity. This will bulge towards the atrium cavity like this. Getting my point? Look at this diagram. So during the isovolumic contraction phase, because of ventricular strong contraction, the tricuspid valve is bulging towards the atrium cavity, although it will never open up towards the atrium cavity normally, because the chordae tendineae are there which is attached with these valves. They will pull the valves, but there will be little bulging of the tricuspid valves towards the atrium cavity. So whenever the valve is bulging towards the atrium cavity is compromised. So what will happen to the cavity pressure? There will be little rise of cavity pressure in the right atrium, and that little rise of cavity pressure here is C wave in JVP or C wave in atrium pressure. So I can understand that C means this is C stands for cusp, and what is happening to the cusp? There is bulging of cusp. Okay, cusp bulging towards right atrium cavity. Right atrium cavity. This bulging of cusp is happening during which phase of cardiac cycle? Your answer, this is happening during isovolumic contraction phase. So getting my point? So this C wave in the JVP or C wave in the right atrium pressure curve will be generated during isovolumic contraction phase of cardiac cycle, right? Now, after the isovolumic contraction phase, what phase of cardiac cycle will start? You all know that at the end of isovolumic contraction phase, there will be starting of ejection. Ejection means there will be opening up of the semilunar valves. Semilunar valve open up means the blood will be ejected here. When the ejection is occurring, do you think this tricuspid valve will still remain bulged towards the atrium cavity? Answer is never. But due to severe contraction of the ventricular chamber, okay, so imagine like this, that the ventricular chamber is contracting to a very severe degree. Ventricular chamber is contracting to a very severe degree like this, okay, towards the pulmonary artery. What will happen? This tricuspid valve will also pull towards this ventricular cavity like this. There is pulling of the tricuspid valves towards this ventricular cavity like this. So whenever the tricuspid valve is pulled towards the ventricular cavity, which is happening during which phase of cardiac cycle? During this ejection phase of cardiac cycle it is happening. You look at the chamber of this atrium. The atrium chamber has increased, volume is increased. Volume increase means what is going to happen to the pressure at the level of this atrium? I can easily understand the pressure at the level of atrium will decrease. That decrease in pressure is denoted here by this X descent. So this X descent is due to enlargement of the right atrium cavity. And why the enlargement of the right atrium cavity is happening? Due to pulling of tricuspid valves, due to pulling of tricuspid valves towards, okay, towards right ventricle. Getting my point? This pulling of tricuspid valve is decreasing the right atrium pressure further, and that is X descent. So I'll wipe this out. So now I can understand, after the end of X descent, the right atrium pressure to a very low point. And this X descent was happening during which phase of cardiac cycle? During the ejection phase of cardiac cycle, this was happening. Okay, right. Now the atrium pressure is to a very low point due to full relaxation of the atrium due to pulling of the tricuspid valve. When the atrium pressure is very low, look at, when the atrium pressure is very low, what is going to happen? Okay, this atrium will suck the blood from the superior vena cava, okay, as well as inferior vena cava. Because the atrium pressure is very low, it is dragging the blood from superior vena cava, it is dragging the blood from inferior vena cava. This returning of blood from IVC and SVCs towards the right atrium, this is known as the venous return phase of right atrium. This is known as the venous return to the right atrium. So whenever more and more blood is returning to the right atrium, what will happen to the atrium pressure? It will rise gradually, and that rise of pressure gradually at the level of atrium is denoted by this wave, that is nothing but my V wave. So V wave means it is nothing but gradual rise of atrium pressure due to returning of blood to the right atrium cavity. So I can say that is nothing but venous return. So I am writing here, V stands for venous return, okay, to right atrium from SVC and IVC, and that is rising the pressure to a very high level. So this is the peak point. So this is the V wave, right? So V wave means now the right atrium pressure is high. So if I ask you, the V wave is generating during which phase of cardiac cycle? Okay, so after the ejection, what phase of cardiac cycle is there? After the ejection, there will be protodiastole and then isovolemic relaxation. So during this protodiastole and during this isovolemic relaxation, the V wave in the JVP or V wave in the right atrium will be created. Now, at the end of this V wave, atrium pressure is very high. Now you look at this chamber, okay, atrium pressure is very high here, right, due to filling of atrium. And what is the status of the ventricle? Ventricular isovolemic relaxation is done, because I told you when venous return is going in the right atrium, what is happening to this ventricle? Ventricle is going for isovolemic relaxation. Isovolemic relaxation means at the end of isovolemic relaxation, ventricular pressure is 0. So due to venous return, atrium pressure is very high, and due to isovolemic relaxation, ventricular pressure is very low. That is happening at the end of V wave, that is happening at the end of isovolemic relaxation. Now what is going to happen? All of you know, now this tricuspid valve is going to open up due to pressure difference. And whenever tricuspid valve is opening up, we all know that the blood will run towards the ventricular cavity. That will leads to starting of ventricular filling. But you look at atrium chamber, what will happen to the atrium pressure? Because the blood is coming from atrium towards the ventricular cavity, atrium pressure will drop down, and that drop down means decrease in atrium pressure, and that is nothing but Y descent in the right atrium. Okay, so Y descent is nothing but due to opening of tricuspid valves. Whenever there is opening of tricuspid valve, ventricular filling is started. That means if I ask you why descent is happening during which phase of cardiac cycle, your answer will be first rapid filling phase as well as during this diastasis phase. There will be more and more dropping of atrium pressure, and that is Y descent. But I am not writing the last rapid filling phase, because whenever there is starting of last rapid filling phase, this is the atrium contraction phase. Whenever atrium will contract, again there will be generation of which wave? That is nothing but A wave. Means again we will be reaching here, that is A wave. So that's why remember this Y descent is happening due to opening up the TV, tricuspid valves, and that is happening during which phase of cardiac cycle? Passive filling phase of cardiac cycle. During active filling phase of cardiac cycle, the A wave in the JVP will be created. Getting my point? So this way you have to remember the difference wave in the JVP, the positive waves and negative wave. So positive wave are A, C and V, and negative wave are X, X dash and Y descent. And I told you how to read JVP along with cardiac cycle. Okay, otherwise you will not be able to corroborate. Right? So if you read like this, then you will be able to understand that A wave is due to atrium contraction. So if there is atrial fibrillation, atrium is not able to contract properly, then you are not going to get this A wave. Right? So this way you can understand the pathology in a better way. So now if I want to plot this A wave in this original diagram or Uyghur's diagram. Okay. So tell me, I want to plot the left atrium pressure wave in this Uyghur's diagram, left atrium pressure changes. So again I am going to get A, C and V wave. So where the A wave will be there in this diagram, where the C wave will be there? Start thinking. So C wave is created during which phase of cardiac cycle? Isovolemic contraction. So note down, during this isovolemic contraction, I am taking a color. Which color I will take? This. So A wave will be created here. Okay. Then there will be creation of a C wave during this isovolemic contraction phase, right? Then what will happen? There will be descent, and then we know that during this ejection, the descent will continue, and then the venous return will start. Venous return will rise the atrium pressure, and at this point, the atrium pressure is going above the, so here. This is the peak of the V wave. This is the peak of the V wave, right? This is C wave and this is my A wave. I hope you are understanding. Okay, I will show you the book diagram, but this way you have to understand the JVP wave or left atrium pressure wave if you corroborate in this Uyghur's diagram. So this is A wave, atrium contraction, then C wave during isovolemic contraction, then during ejection phase there is decrease in atrium pressure, then due to venous return atrium pressure is rising. At this point, atrium pressure is more than ventricular pressure. Look at what is the phase. This phase, if you look at this line, this is nothing but end of isovolemic relaxation. End of isovolemic relaxation means ventricular pressure is 0 millimeter of mercury and atrium pressure is very high, that is the V wave. So what is going to happen if I ask you that at this point what is going to happen? Your answer will be that this will leads to opening of mitral valves, because we are drawing the left ventricle. This is opening of mitral valves, right? And mitral valve closure will happen at which point? Closure will happen at the onset of systole. Onset of systole means this is the point which is onset of systole. So this is the point where there will be closure of mitral valve. Okay, so this is closure point of mitral valve. Getting my point? So now if you look at this is the closure point of the mitral valve, means this is the first heart sound, right? So this is my first heart sound, and second heart sound, this is the closure point of the aortic valve. This is the second heart sound, right? Okay, I hope you are understanding. And this is the opening point of the mitral valve. Okay, so in this diagram, okay, now this means more and more complicated. I want to draw my ECG, right? So ECG means we know that first heart sound that is going to produce at the peak of the R wave. So I have to draw the ECG diagram in such a way that P wave, then Q, this peak of R wave is corroborating with the first heart sound, then S wave, okay, and the end of T wave has to corroborate it with this second heart sound. Okay, so this is T wave, so almost this is corroborating with the second heart sound. So this is P and this is nothing but my ECG, right? Getting my point? So now if you look at the whole diagram, so we have plotted the aortic pressure curve, right? This is the aortic pressure curve we have already discussed. We have plotted the ventricular pressure curve, okay, that will rise like this and then it will fall like this, okay. And we have also plotted the atrium pressure curve, that is nothing but A, C, V. What diagram this is? This is nothing but Uyghur's diagram, I told you, right? So now after understanding all these waves, if you look at the diagram from book, okay, so this is a diagram I have taken from book, Uyghur's diagram, okay. So in this diagram, could you follow this aortic pressure curve, okay? So this is the aortic pressure curve, broken line, right? Aortic pressure curve. Could you follow this ventricular pressure curve, this solid line, this is the ventricular pressure curve, right? If you look carefully, whatever I told you, you will be able to get here also. This is aortic, ventricular pressure curve. And if I ask you, look at the atrium pressure changes, so A wave followed by C wave followed by V wave, you are finding out here, right? And here this ECG is also plotted, R wave, T wave, everything is plotted. Another diagram, similar kind of diagram. So now this is more clearer, right? More clearer, okay. So again you are getting the ventricular wave and atrium wave, everything. So this is the typical diagram of Uyghur's diagram, which is given in book. Now in this Uyghur's diagram, one thing I have to understand, that is QS2, okay. So I'll go back to my diagram, okay, here, okay. So what I'm saying, QS2. So Q is the Q wave and S2 is the second heart sound. That is the simple meaning. Q is the Q wave in the ECG and S2 is the second heart sound. So if you record the second heart sound by a phonocardiogram, so QS2, S2 is recorded by a instrument that is known as phonocardiogram, okay, recording of the heart sound, that will record the amplitude and time duration of the sound. And this Q, this is recorded by ECG. So this QS2 is known as electromechanical systole. This is known as electromechanical systole, right? So starting point of the Q wave, okay, up to this S2, this duration is known as QS2, which is known as electromechanical systole. Electrical systole means depolarization. Where from the depolarization is starting? The Q wave. That's why you are taking the Q wave. And ending of depolarization, ending of systole means when the semilunar valve is closed, that is the second heart sound, right? So that's why if you look at, this is the second heart sound point, that is the end of systole, and beginning of electrical systole is the Q wave. That's why this QS2 is taken as the electromechanical systole. Now within this electromechanical systole, you remember that QS2 is equal to 2 part pre-ejection period plus left ventricular ejection period. I will tell you. Left ventricular ejection period, where from the ejection is starting and where from the ejection is ending. It is very simple. If you look at the aortic pressure curve, how to record the aortic pressure curve? By carotid pressure transducer. I can easily understand that this is the onset point of ejection and this dicrotic notch or the second heart sound, that is the ending point of ejection. So beginning point of ejection is here and ending point of ejection is dicrotic notch. The time duration between these two is known as left ventricular ejection period, right? So in this Uyghur's diagram, if I ask you which one is the left ventricular ejection period, your simple answer will be that from this to this, left ventricular ejection period, from the opening of this semilunar valve up to the closure of this semilunar valve. That is the actual left ventricular ejection period. So before the left ventricular ejection period, the time duration of this QS2 segment is known as pre-ejection period. I told you pre-ejection period means this onset of Q wave up to the onset of this ejection. This will be known as the pre-ejection period, right? Getting my point? So ideally, your left ventricular ejection period is calculated first and QS2 is calculated first. How to calculate the QS2? QS2 is taken from onset of Q up to the S2, and then left ventricular ejection is calculated by this aortic pressure curve, and then if you subtract this QS2 minus left ventricular ejection period, you are going to get the pre-ejection period. So this is known as pre-ejection period, right? Onset of QF up to the opening up of the semilunar valve. Why we are calculating this too? Okay, because you know that this pre-ejection period upon left ventricular ejection period has a ratio of 0.35, and this ratio is inversely proportionate to ejection fraction of the heart. Ejection fraction we will be discussing in the next classes, but all of you know that. So whenever your ejection fraction is rising, this ratio, okay, what will happen? The ratio will decrease. Okay, whenever ejection fraction is rising, like for example, okay, if you stimulate the sympathetic system, okay, your ejection fraction will rise. If you give this drug like digoxin, okay, your ejection fraction will rise. Whenever your ejection fraction is rising, what will happen to this ratio? The ratio will decrease. Okay, this has been asked in MCQ, particularly the INI set type of MCQ, so that way you have to look at. Okay, so this is all about the Uyghur's diagram, and we have seen the diagram from book. Now again I am going back to this Uyghur's diagram so that you don't forget this. Okay, now you look at very carefully. Normally aortic pressure and ventricular pressure, they are changing proportionally during this ejection phase, and atrium pressure and ventricular pressure, they are changing proportionally during filling phase or diastolic phase. Am I clear? So aortic pressure and ventricular pressure, if you look at here, okay, there is a little gap between this aortic pressure and ventricular, very little gap, but they are changing proportionally during which phase of cardiac cycle? During systole. And this atrium pressure, okay, so this V wave is the part of the atrium pressure, and this ventricular pressure, they are changing proportionally during which phase of cardiac cycle? During this diastolic phase of cardiac cycle. This is important. Why? If you want to understand or diagnose different valvular diseases based on this Uyghur's diagram, suppose you have introduced one catheter inside the left ventricle, right? And you are also measuring the left atrium pressure, as well as you are also measuring your aortic pressure by carotid pressure transducer. So you are going to plot the Uyghur's diagram from left ventricle. By plotting this Uyghur's diagram, the diagnosis of valvular disease can be done. Like for example, valvular stenosis, right? So here you can find out aortic valve stenosis and here mitral valve stenosis. So first, aortic valve stenosis. How to look at this Uyghur's diagram and how to diagnose if this is given as an image based question. So this is ventricle and this is arch of aorta, and atrium is here, atrium is here. So this is left atrium and this is my aorta. I hope you get this diagram, right? So aortic valve stenosis means all of you know that this aperture or this opening of this aortic valve is reduced and the valve is not opening easily. So when the isovolemic contraction is going on, okay, so ventricle is contracting isovolumically, it is generating pressure, but due to stenosis it is not able to open up this valve, aortic valve, easily. So what will happen? The ventricular pressure has to be very high. Then and then only you are going to open up this aortic valve because that is stenosed, right? So ventricular pressure will be very high during this isovolemic contraction phase, even during the ejection phase, and even after that the ventricle will not be able to eject huge amount of blood to the arch of aorta. Why? Because the valve is stenosed, the aperture of the valve is reduced. That's why I can understand that during this ejection phase as well as during this isovolemic contraction phase, ventricular pressure is rising to a very high level, but aortic pressure is not rising proportionally. There will be a very huge gap between ventricular pressure curve and aortic pressure curve, and that gap will be present in which phase of cardiac cycle? During systole. So you have seen earlier that this is the ejection phase. If you look at This is the ejection phase where ventricular pressure is rising to a very, very high level. But look at the aortic pressure. Aortic pressure is not rising proportionally. Very, very less rise of aortic pressure. And there is a huge gap between this ventricular pressure and aortic pressure during systole. This gap is the identifying feature of aortic valve stenosis disease. Right? Okay. Now, if I ask you mitral valve stenosis, how I am going to imagine? So this is my arch of aorta, this is my left ventricle, okay, and left atrium is here. Now I have to look at mitral valve stenosis, means the problem is arising between left atrium and left ventricle. So I have to look at the left atrium pressure changes and left ventricular pressure changes, right? Because the stenosis is here at the level of mitral valve. So mitral valve stenosis means the blood from this, okay, the blood from this left atrium will not be able to enter in the ventricle easily, means ventricular filling will not be proper. Filling of ventricle is occurring. Which phase of cardiac cycle you are talking of? You are talking of diastolic phase of cardiac cycle. So I have to look at the pressure of left atrium and left ventricle during which phase of cardiac cycle? During diastole. I told you earlier that during diastole, okay, so this atrium pressure as well as this ventricular pressure, they changes proportionally. But due to this valvular stenosis, mitral valve stenosis, atrium will contract, atrium will try to give blood to the ventricle, but it will not be able to give. So what will happen? The left atrium pressure will rise to a very, very high level, but the end diastolic pressure of the ventricle will not rise that much. So there will be a gap between atrium pressure and ventricular pressure curve. So if you find out here, this is the diastolic portion of the curve, this is the diastolic portion of the curve. So during this diastole, I can find out that there is a big gap between this left atrium pressure and left ventricular pressure, and that gap is diagnosis of mitral valve stenosis. So getting my point? So stenosis means I have to look at the gap between ventricular curve and aortic curve for aortic stenosis, and for left atrium and left ventricular pressure curve during mitral stenosis, right? Now if you look at the regurgitation or insufficiency, valvular insufficiency or valvular regurgitations, right? So aortic valve regurgitation, very peculiar thing. So this is left ventricle. The aortic valve regurgitation means the valve is not able to close completely during diastole of the ventricle. Okay, so I have to think of diastole, right? During diastole, what will happen? The valve should be closed completely, but aortic regurgitation means the valve is not completely closed. So what will happen? Some of the blood will fall back from the aorta to the ventricle. That is the basic pathology. So blood is coming back from aorta to the ventricle, as well as the ventricle will get its blood from atrium also. So this is left atrium. Blood will also reach from left atrium to left ventricle. That is the normal filling of ventricle. So one source of blood is coming from atrium, another source of blood is coming from the arch of aorta. What will happen to the end diastolic volume? It will be very high. Whenever end diastolic volume increases, I can easily understand that my stroke volume will also increase, right? If stroke volume increases, then systolic blood pressure will also increase. This relationship you will understand better in the blood pressure chapter. I will discuss why the stroke volume is related to systolic blood pressure. But for the time being, you remember, due to increase in the stroke volume, systolic blood pressure will be very high, but the diastolic blood pressure will be very low, because blood is falling back to the ventricle during diastole. So aortic regurgitation means there will be a huge gap between systolic blood pressure and diastolic blood pressure. So if I look at the aortic pressure changes, this curve, so this will be very high and this diastolic blood pressure will be very low. Am I clear? So this is the identifying feature of this Uyghur's diagram also. You look at this, diastolic pressure is here. It is very lower than even the 100 millimeter mercury also. But you look at the systolic blood pressure, it is here. So there is a big gap between systolic and diastolic blood pressure. I can say the pulse pressure will be very high, and this is the diagnosis of aortic valve regurgitations, right? Okay, now if you look at the mitral valve regurgitations, okay, so where the regurgitation is occurring, the blood is regurgitated back at the level of left atrium, okay, left atrium through the mitral valve. So this is the mitral valve which is not closing properly, due to which during this systole when the ventricle is contracting, the blood should go only in one direction, that is towards the arch of aorta, but the mitral valve is not closed properly, so some blood is also going back to the atrium. So atrium will get more blood, so atrium pressure will rise, but atrium normally also gets blood from the pulmonary vein. So the pulmonary vein is also giving the blood to the left atrium. So now the left atrium is getting two sources of blood. Okay, one is coming from pulmonary vein and one is coming from ventricle during regurgitation. So what will happen? The right atrium pressure will be very, very high, and this pressure will be high during which phase of right atrium? The filling of right atrium, the venous return phase of right atrium. This is nothing but the venous return phase. The blood is returning from pulmonary vein, but additionally the right atrium is also left atrium is also getting blood from the regurgitation. So left atrium is getting huge amount of blood. One is from venous return, one is from regurgitation. So the venous return wave or V wave in the atrium pressure will be very, 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 very prominent, and that is the identifying feature of this mitral valve regurgitation. See here, the tall V wave, okay, it is very, very high. If you look at this this pressure, okay, so here you can find out the right atrium pressure, left atrium pressure, the V wave, it is near equal to 25, maybe 30, and that will leads to pulmonary congestion also. So this tall V wave in the Uyghur's diagram is an identifying feature of mitral valve regurgitations, right? So this is all about your cardiac cycle along with certain applied aspect.